Hey friends, today we're diving into a topic that's more relevant than ever, mental health, in the face of our challenging climate. Now, I know that what you're thinking, climate change and mental health, how do these connect? Well, the link is both fascinating and a little alarming, but don't worry, we're also exploring how we can turn the tide. First off, the planet is experiencing some extreme weather events. Severe droughts, scorching heat waves, hurricanes, tropical storms are not only shaking up our environment but also taking a toll on our minds. These natural disasters can cause a whirlwind of psychological responses like anxiety, depression, acute stress, and even PTSD. Losing your home, your resources, your routine, it's enough to make anyone feel overwhelmed. It's not just the immediate aftermath. Long-term mental health impacts can linger, sleep disturbances, feelings of despair, sense of helplessness. The epidemiological landscape shows that vulnerable populations like elderly, those with existing health conditions, or communities hit hardest by disasters are increased risk of developing mental disorders such as depression, PTSD, or complex health needs. Factors like loss of social support, separation from loved ones, or reduced access to healthcare can make recovery even tougher. Prevention and mitigation are key. Reducing climate change itself through sustainable practices can lessen the frequency and the severity of disasters. But on the more immediate level, psychosocial support and community strengthening play huge roles. Community resilience, when neighbors come together, support each other, and rebuild, can buffer the mental health blow. Psychosocial interventions, including therapies and mental health services, are special, especially during the recovery phase. They help individuals navigate trauma, manage stress, and rebuild their psychological strength. Speaking of strength, many people draw resilience from their cultural beliefs, religious practices, or positive outlooks. These are powerful tools in coping with adversity. Formal support systems like mental health professionals and community programs provide critical assistance, offering emotional support and practical strategies to manage anxiety, depression, or trauma. For example, therapies tailored for conditions like PTSD or depression can help process traumatic events, reduce symptoms, and promote recovery. Times of extreme heat or seasonal change in mood, some might experience seasonal affective disorder. Depressive symptoms like the seasonal variations, isolation, and reduced outdoor activities during such times can further impact mental well-being, so staying connected and engaging in routine activities can foster resilience. Mental health isn't just about individual coping, it's intertwined with our environment. Environmental stressors like heat waves and storms can cause physical disabilities, disrupt daily routines, or impair access to healthcare, combining mental health challenges. That's why public health intervention focus on community support, disaster preparedness, and environmental resilience are so vital. Finally, managing mental stress associated with climate-related events involves a mix of strategies, stress management techniques, psychological support, and fostering hope and positivity. Recognize the psychological impact of disaster, addressing head-on with evidence-based interventions can make all the difference.